Okay, so we're going to talk a little bit about the stretcher and some of the features that it has. The best thing to remember, just like the stair chair when we talked about it, on the stretcher, same concept, made by the same company. If it's in red, it does something. So as you look underneath right here, you see a red switch. That switch, when the foot of the bed is elevated, that's what lowers that down. The red buttons, top and bottom, that's what lifts or lowers the stretcher. It's in red. On this side, you have the brake. It is in red. It moves, locks it in place. On your handle, it's in red. It moves your handle forward. This is how you lower or lift the head up. This is what lifts this up. So when you pull the stretcher out, that's how you lift that up over the hook. And these right here, they unlock and you can slide this in. Anytime you slide this in, you need to make sure that it locks so that if you have to use the stretcher, it's locked in place. You want to make sure that you pull this out before you go to load it in your ambulance, or it's not going to fit. Okay, on this example we're going to show how important it is to have your stretcher once you put it in the ambulance, that if it needs to be lowered down to connect on that hook, that you do so and not just put it in and then have your partner lift from the back, and if they come out any little bit, the stretcher could possibly fall. And I'm going to show you an example of what not to do. So I'm going to put the stretcher in, and as you can see how high the stretcher is, if he picked up on it right now and had to pull back, the stretcher could fall to the ground, and we don't want that. So once you get the stretcher in, if you have this much space, we're going to need to lower it down so that if he comes back, it locks into place. Now that our patient is on the stretcher, my partner's going to lift the patient up in the air. And you want to make sure that while he's doing this, that you stand behind the stretcher so that if something happens, you can go to this side or this side if something happens. We don't want to tip the patient over, so we always want to make sure that somebody is on all parts of the stretcher, front and back. Go ahead and lift up. So now that we're in this position, we can either wheel the patient to where we need to go, to the truck, or outside. And you always want to stand back in the back if at all possible, so that you have complete control over this stretcher and the back of it. Go ahead. Alright, so now we're going to move the stretcher to the ambulance, and we're going to lower our patient up. So as my partner and I go towards the ambulance, I want to make sure that I have a hold of the stretcher. Never let go of the stretcher while doing this. Make sure that the hook latches. Now my partner can load the patient up in the back of the ambulance. For this example, we have found an elderly person walking down the road that was nice enough to volunteer his time to allow us to demonstrate a situation. As we look at this situation, it would be best for her to grab some help to help lift this patient up in the back of the ambulance. Not saying that she cannot do it, but any time that you can get some help to load the stretcher, because the stretcher itself is quite heavy compared to what we used to have, so it's always best to get some help anytime you feel the need to do so. Anytime you have a patient on the stretcher, it's always best to take the patient in a front to back pulling manner. You never want to pull the stretcher sideways. This is an example of what happens when you try to maneuver the stretcher sideways and how fast something can happen. It doesn't take much for that stretcher to tip over. In this example, we used an extension cord, a rock, a small pebble. Anything could cause that stretcher to tip over at any point in time. So anytime that you have a patient on your stretcher, you always need to have one crew member at the front of it, one crew member at the back of it, so we do not have any incidents of the stretcher tipping over. On this demonstration, we're going to show an example of when we all hear the dreaded, the battery's dead. What are we going to do since the battery has died? Well, we need to still get the patient up, and there's a mechanism that will do that on all these stretchers. There's a little red handle right down here that Cal is pointing to that you can pull that and lift up. A lot of times it helps that you get somebody on one side or the other, not lifting up too hard, risking to dump the patient, but pushing down on the foot portion so it will help them when they're lifting and you push down on that shock. You ready? 1, 2, 3. Okay. This will get the stretcher up in the position so that it can be loaded in the truck. Hopefully you got an extra battery on your ambulance so you can trade it out at that time, but it gets you to where you need to be. That is an example of loading the stretcher without a battery and having to manually pull the carriage up. Okay, on this example we're going to show taking the patient out on the stretcher with 2 people. We also have tarps on all the box trucks, and some of the ambulances may have them as well. The tarp is a device that we may use for our obese patients if they cannot ambulate out of the house. We have to get them carried out of the house. The tarp is a piece of equipment that we may use to do that. This one here is made by Stryker. It's got handles. One at each end, and then there's handles all the way around. It's always best that if you're going to have to use the tarp to move somebody, that you make sure that you have as many people on this tarp as possible. Try to get somebody on each handle to safely move that patient so that all the responders are safe. Narrow hallways are always an obstacle in a lot of houses, so you may have to get the patient started through the doorway or through the hallway and move the patient to each responder so that it makes it easier on getting the patient out. Remember, it's our safety that we want to concentrate on. We want to take care of the patient, but we have to do it in a safe manner to keep us safe as well.